Welcome to Talkin Maine with Tom Saviello, the bow tie boy, and my good friend, Dr. Dora Mills.
Hey, great to see you.
So are you the first sister?
I don't know.
Peter must be the first brother.
I think I'm the only sister.
Well, okay, so the only sister. So that makes you the first sister. That could
I
make
don't know.
And then Paul is like the third brother. Second.
Well, that's right.
Paul's been on the show a couple times.
Has he?
Yeah, we come in and talk.
I've been here. This is
yeah,
my
that's right. I think the third time. I think
third
so.
time?
Yeah,
It's been a while.
It's been a while.
We were at the Pierce house together a few
Pierce
years
house,
ago.
and we have to look it up, but I know you've come on before to talk about stuff. But we got something going on in the state, and you have been kind enough when I reached out to come on the show to kind of update us on what's happening with COVID.
Sure.
Jay Naliboff came on and did something early on, like 2 years ago.
Oh, yeah.
And things have changed dramatically since then.
They sure have. You know, I think the one thing is certain, and that's change.
Yeah, in this case, very much so.
Unfortunately.
Well, is it Isaac? What doctor? Who's the medical?
Izaki Ross,
Izaki.
Dr. Ross Izaki, good
Dr.
friend,
Ross, yeah.
great guy.
He talked a little bit and taught me some things the other day, but let's talk about COVID.
Yeah.
What's so different about it versus like a cold?
Well, great question. And so for now with Omicron, the current variant, actually a lot of people who are fully vaccinated, including booster shots, and if they're young and healthy, they are getting it very much like a cold very often. A sore throat, runny nose, fatigue, a headache, sometimes a little bit of fever. And so it can come off as sounding and feeling like a cold. So if you think you just have a cold, you really do need to get tested for COVID because you don't want to be transmitting it to other people. And if you're at high risk for hospitalizations, there are some medications that can be given to reduce your risk for hospitalizations. So, but with that said, there are a lot of people who do not experience it just like a cold. There are people who are otherwise healthy and fully vaccinated, sometimes can get it more severely. But anybody who's older or who's immune compromised, whose immune systems do not mount a sufficient response to the vaccine, and elderly people are oftentimes in that category. They often do not mount a really strong response to the vaccines. Anybody else who's immune compromised, either from having like an organ transplant, like a kidney transplant, or they have autoimmune diseases and are on medications, or people who are just have diabetes, heart disease, other lung disease, things like that, they can contract it very severely. People who are pregnant, pregnancy actually causes your immune system to act funky, and so. And in particular, if they're unvaccinated, anybody who's unvaccinated, and even if they had COVID earlier on, unless they've had COVID very recently, they are susceptible as well. So they can get it much more seriously. And what they oftentimes get is a sudden onset of a fever, sometimes cold symptoms as well, but then it quickly, oftentimes, goes into their lungs. Even with Omicron, they have a hard time breathing. Sometimes they get other organs that are involved, so they end up in kidney failure. They sometimes have blood clotting, so they can have strokes. It's really strange. Like you have a lot of people presenting with these respiratory symptoms, fever and a cough and all that, and can be very severely affected. But then sometimes we just see patients who come in with looks like exacerbations of their heart disease or their diabetes, or they have a new stroke, or even sometimes we see people who have a new onset of a psychiatric illness, and you test them, because we test everybody who's admitted to the hospital, and you find COVID. And there's actually reports of COVID causing a variety of presentations besides respiratory.
Are those people, though, predisposed to it, or like, for example, I've had my 3 shots.
Yeah.
I'm glad to have it, like
Good.
I said, and I was ready, lined up, got mine right away.
Good.
I believe the technology. I believe, as I talked yesterday, this development of this technology is 20 years old. It's not new.
Yeah.
We just happen to fortunately have it so that we can grab onto it.
Yeah.
And The only thing that hurt this time is when they put that huge chip. It was as big as my phone in my. Oh, I'm sorry, I'm not supposed to.
But, no, that's your phone following you. We all have chips that follow us.
Oh, that's right. I know.
That's,
when people tell me about the chip, I kind of laugh. I said, "Do you carry a cell phone? They know right where you are." I mean, the bad guys that rob banks and say, "I wasn't there." They get their phone, they subpoena the records, and they find out right where they were.
Exactly.
So I'm 71. So my age already puts me in a worrisome group. However, I'm pretty healthy.
Yeah.
Would I be one that would manifest the lung stuff? Probably, or probably,
yes. So most people who get sick with it, and very sick with it, do manifest the lung symptoms, a cough, hard time breathing. But I only mention these others is that we are seeing more and more people that come in with other types of presentations. And sometimes they just say, oh, this is just my emphysema worse, or this is just my heart disease, my angina is worse, or angina as some people call it, or I've got diabetes and my diabetes is worse. Well, what we're also finding is sometimes COVID, when you've got COVID, you may not have necessarily all the classic symptoms, but your other underlying diseases are much worse. Yeah. And then there's these interesting but strange presentations of just, we've had people that are new onset of psychosis, where they're just out of touch with reality. Yeah, it's a very strange virus. And so when people say, oh, you know, I'm just going to go and get it this time around with this surge, and then I'll be done with it. It's like, you know, I wouldn't want to do that, because for one thing, you could be transmitting it to other people who could get it more severely. Second of all, even if you're young and healthy, you don't know, but what you're going to end up.
You could have something going on in your system that you don't know about. You know, so when I looked at the data, and I laugh at myself because I've been complaining I don't have I'm a number guy. I like to look at the numbers. And getting prepared to do this, I found out the CDC has a wonderful site that really has all the data on it. And when I realized, you know, we're at Omicron, I don't know the Greek alphabet, but there are a whole bunch that have come. So people say, oh, all of a sudden they got this new one. Well, they've actually had all kinds of new ones. They just haven't spread like Delta and Omicron.
Exactly.
And so the people don't know that. But on the death rate, you show that the data shows that, yes, it's in us older people. However, the infections, just as you've described, are in the younger people who are, their immune systems can fight it off. But they could well bring it into the household pretty easily from school or wherever.
That is an excellent point, and I'm glad you made it. And I'll just put an exclamation point on it to say, yes, we are seeing across the country and in European countries where there's a big Omicron surge, it's primarily younger people. Now, for you and me, you know, young is relative.
Yeah, right. So we're young.
We're young.
On the heart.
Under 50, exactly. Under 50, but particularly the younger you are, the more likely they are contracting it. And I think partly because they're the ones who are gathering, they're in school, they're in extracurricular activities, they're in college and whatever, and gathering with friends. And so, and oftentimes those are the people working on retail, you know, the front lines. So they're the ones contracting it and seem to be transmitting it the most. But the people who are ending up in the hospitals are, it's all ages right now, but the average age at Maine Health of our 10 hospitals of people with COVID right now is 60. Now that's really different from the mid-70s from a year ago. So it's the average age has come down of the people who are hospitalized, but it's still around 60. And so, you know, we have a lot of people who are in their 80s and 70s and 60s who are hospitalized. When you look at our intensive care units and people who are on ventilators, those are, the vast majority of them are people who are unvaccinated and all ages.
That was my next question, that of the vaccinated, and we've heard this, but now it'd be good to say it, if you're vaccinated, let me say this, of those that are in the hospital, how many of them are unvaccinated?
So it particularly now, as more and more people are getting vaccinated, what we're seeing is the people who are really sick, who are in the intensive care units or on ventilators, which is a subset of people in the ICUs, those people are primarily unvaccinated. Now, when you look at the whole hospitalized population, you get a little bit more even distribution. They're still more likely to be unvaccinated, but you are getting people who are vaccinated whose diabetes is exacerbated, you know, that kind of thing. So the vaccine is keeping them out of the ICU, is keeping them from being really ill. But with Omicron, it's so much more contagious, and it's also got more immune evasion, meaning even if you're vaccinated, you can contract it. But I got to just stop right there and say, I hear people all the time, especially on social media, say, well, I'm not going to get vaccinated because you can contract it anyway and transmit it anyway, whether you're vaccinated or not. Not true. Okay, just not true. If you are vaccinated, so yes, you can contract it and transmit it. You're much, 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 much less likely. And that's the piece that is missing from people who say, hey, you can contract it anyway. Yeah, you can, but the vaccine greatly reduces your chances of contracting it and contracting it, having a serious illness, and from transmitting it to others. So if you're fully vaccinated, including now a booster, and I say fully vaccinated, I mean up to date, 3 shots of mRNA, so Pfizer, Moderna. So you got to have that booster shot. With Omicron, you got to have the booster shot to be protected. You got to have that booster shot. So with the booster shot, if you do contract it, what we're seeing are people primarily getting either no symptoms, and we just happen to test them for some other reason,
right,
or they're getting very mild symptoms for a very short amount of time, like 2 or 3 days as a mild cold. You're not going to be transmitting it. If you don't have a heavy cough, you're not going to be transmitting it as much. And their viral load, the amount of virus that they have when they do contract it and they're fully vaccinated and boosted, is very small. So yeah, you can contract it, you can transmit it, but not anything like if you're unvaccinated.
That's no different than the flu shot, though.
Yeah, that's right.
The flu shot, I've had them before. In fact, I stopped getting them because I got so mad because I was still getting the flu. But then when I realized that the flu I got was a lot less contagious than I got it before. Yeah. So this is no different. Yes, you are going to have some breakthrough, but it's still going to minimize the impact on me. Exactly. By the way, I had 4 shots. One was a shot of Jack Daniels. I would suggest that to everybody, and I'm repeating myself like every other night, and it helps a lot.
Oh, God, Tom.
Jared Golden was up visiting the other day, and we were joking about stuff, and so I wrote him yesterday, and we had a few adult beverages, and he had gotten tested yesterday, so he just wrote back to me, said, by the way, I got tested yesterday, and I was okay. I wrote back, yeah, well, you should have an extra shot. That's why. So how is Omicron? Why? We talked a little bit this before we went on air. Why is Omicron so more contagious than even go back to the original COVID-19 that we first had come with us?
Yeah. Well, there's several reasons, but one is that it seems to be much more airborne. So it is on what we call aerosol. So when you breathe and you talk, there are these microscopic, you can't see them, little droplets of moisture that come out of your nose and mouth. And viruses are on those droplets. Now, droplets are somewhat heavier. So at the very beginning of COVID, back in the spring of 2020, it was thought to be mostly transmitted by droplets, and it seemed to have been. Droplets don't go very far. Again, you don't see them, but when in the normal course of talking, they come out of your nose and mouth, and they tend to drop down, within 6 feet. So that's why there was this whole thing about staying 6 feet apart. Except that if you're projecting, like if I didn't have this mask on, and I'm projecting, or I'm singing, I'm shouting, those droplets go farther. And that's why there was all this public health education about don't sing and shout with each other, which I know it sounds terrible, like, putting water on a fire, but, and it's a horrible thing as a public health professional to have to say, please don't sing without a mask. Yeah. I mean, it's just, oh my goodness. But
you don't want me to sing even with a mask.
Yeah, so you don't want me singing without a mask, with or without a mask, it's true. So, but the projecting does make it go farther. So then, as these mutations have evolved, the virus has gotten so that it is now hitchhiking not just on droplets, but on aerosols, which are smaller droplets that go much farther and are airborne. So there are some examples of Omicron being transmitted from people who are not even in the same room, but are nearby rooms that share a ventilation system.
Oh, wow.
So that's a whole different ballgame now. So the masks help a lot because they keep those droplets and aerosols here. But that's why this US CDC is saying, you know, you really shouldn't have, and actually I see you've got one, but a fabric mask. But you know, they just came out with it the last several days. So you've got a little bit of time here, but you got to go get a surgical mask, a better mask, okay? And I've got an N95 on here. So that's
Is that the new one that they're recommending now?
Yes.
Okay.
So N95s and surgical or procedural medical masks. Those are the types you really want to, you know, to use. Now, it's not to say you can't use a fabric mask. You should have a couple of layers there, or a filter, one with a filter. You know, you can put a coffee filter in there if you got a little hole in there to put it into. But the masks keep those aerosols and droplets inside. So that you're not, and you want it well fitted because stuff can go out. Now, this is during a surge. You're not going to have to do this forever, but you know, during a surge like right now, there's a lot of this disease around, and so so that's why it's, you know, you want to keep those masks on for right now to keep the transmission lower, because especially if you've got somebody in the store that you're in, you know, who's unvaccinated, and they're just coming down with it, then so they may not have any symptoms, but the day or two before, they've got lots of virus, and they're emitting these aerosols that you can't see that are floating through the air that have the virus in it. Now, if they're vaccinated, they're not going to have as much, but you know, I know here in Franklin County, unfortunately, we've got about almost 40% or so of the population unvaccinated.
Yeah, I looked that up. We have 62% or something like that.
Yeah, so it's, you know, that's not good. So you go into a crowded indoor place, excuse me, and you know, if you look at people around you, you think, wow, 40% or so of people here might not be vaccinated. The disease rate is really high right now, and unvaccinated people are much more likely to be producing lots and lots of aerosols with the virus. So that's why I've got now, you know, wearing an N95 during the surge. Now, you know, these surges come and go like moguls at Saddleback, you know, or Titcomb, you know.
So Dora, where's this new talk about? So let's talk about treatment. Let's do that, and then I want to make sure that we talk about this pill that's out there that they say may be able to help with people with mild symptoms that's soon to be approved. So how do you treat someone coming into the hospital that's got a high? Do you give them the horse vaccine that Donald Trump wanted them to have? I can't remember what it is. Or
the ivermectin.
Yeah. No, I didn't mean to joke, but in the same sense, how are you? Because this is one of the things I also picked up yesterday. Used to be that the COVID patients, like in Franklin County, went to Portland. Yeah. But now you've developed your technology or your treatment mechanism so they can stay home. So what have you done around that?
Well, first of all, I want to give a big shout out to my colleagues at Franklin Memorial Hospital. They are, I mean, our people on the healthcare front lines are our heroes.
Absolutely right.
There are lots of heroes in all of this. Yes. Teachers, people taking care of elderly relatives. I mean, lots and lots of heroes. But amongst them are our frontline healthcare workers, and particularly right now. They are absolutely inundated with people with COVID or might have COVID. And other patients. And so, and I'm especially proud of Franklin Memorial Hospital because not only did I practice there for several years back in the 1990s and grew up with a lot of people who worked there because I grew up here, but also I work at Maine Health Corporate, the corporate headquarters of that oversee Franklin and other hospitals. And so I'm just so proud of what they've done. And you're right, early on, we had COVID patients that would show up at Franklin Memorial Hospital. They would mostly automatically get shipped down to Maine Medical Center. And what we've developed over the last almost 2 years now is the capacity to take care of patients throughout rural Maine as well as urban Maine. And part of this was by necessity, excuse me, the air is kind of dry, so this is my, excuse me, my early morning allergies. But So partly out of necessity, we've got so many patients with COVID right now across the state. Maine Medical Center, Eastern Maine Medical Center, Maine General, Central Maine Medical Center. They can't take care of all of them. So we've had to build that capacity. But also, what's so exciting to see is that the nurses and doctors and respiratory therapists and others at Franklin Memorial Hospital and other such hospitals have really risen to the occasion. And they've learned how to take care of much sicker patients than they've had to in recent years. So I think something of good that might come out of this is really maybe a renaissance of a type of rural hospitals. So that aside, that's not.
Let me just say this: I'm not surprised about Franklin Memorial Hospital because they're special people there.
Yeah, they are.
I've said that all along. And,
They are.
And I'm so proud to have been working with them of getting their message out here on the station. So they're a significant part of this community.
They are, and I just love them, and I'm just so appreciative of everything they're doing. So then going back to your question.
That's all right. This is good.
So there are some outpatient treatments now, meaning if you contract COVID and you're at high risk for being hospitalized, there are now some approved medications that can reduce your risk of being hospitalized. However, and this is a big however, there is a tremendous shortage of these medications across the country. And the reason is that they're new. Most of the three of them are new, and the production hasn't ramped up yet. The production will ramp up. There'll be more of them, but that's probably for the next surge. It's not going to help us through this surge. So there's a monoclonal antibody that's very good called Sotrovimid. There's also a new drug called Paxlovid that's very good, and another new drug called molnupiravir. I don't know the drug companies how they come up with these names, but so these medications are good. And one of the first one's an IV, an intravenous medication, and the other two are oral. But again, there's almost like, just to give you an idea, the Sotrovimid, the monoclonal antibody, I think right now we're getting about 70 to 80 doses a week for the whole state of Maine.
Oh, wow.
And Paxlovid, we got about 260 doses for the month of January for the whole state of Maine.
Wow.
And yet we're getting about 2,000 or 3,000 people
Cases.
positive every single day. And then there's another one, remdesivir, that is given to inpatients that we can give to outpatients, but it's an intravenous drug you have to give over 3 days.
Wow.
It's complicated and very complicated to give. So you can't count on these medications to keep you out of the hospital because we don't have enough of them. But we are trying, we do have a few doses of them. So we're trying to make sure that those people who are at the highest risk of being hospitalized can get those medications, but it is a very big challenge right now.
So is there, I've read where there's a pill on the horizon that could be taken instead of a shot, is that correct?
Yes, so two of those drugs I mentioned are oral, meaning it's a pill, but again, very, very, very few doses. So can't count on them. But the good news is that the pharmaceutical research and development organizations and with the FDA and the NIH and others are doing the research and are starting to produce these medications. So in a few months, maybe even 10, 12, 13, 14 weeks, we'll be in a much better place because we'll have some medications that you can take as an outpatient to prevent your chances of getting hospitalized, whether you're vaccinated or not. It's just this horrible surge we're going through right now. We don't have those yet. So they're on the horizon, so that's good. But
So do you see anything on the horizon in the medical profession beyond Omicron? I mean, is there another one out there that we're going to hear about?
So the game changer in 2021 was Delta. And Delta taught us that this virus can mutate and mutate significantly. And that then we knew, because a year ago, so think back to a year ago, I would have sat here and said, 2021, as many people did say, It's a fantastic year. We've got these amazing vaccines. We just got to get everybody vaccinated.
Right.
That's water on the fire. Vaccine is water on the pandemic fire. And, you know, in next Christmas, next Thanksgiving, meaning 2021, hopefully things will be better. Then along came Alpha variant, which was concerning, but then Delta occurred. And of course, Delta came out of India. Last spring, India had enormous surge.
That, yes.
And whenever you have a virus that can significantly replicating, reproducing tremendously, you're going to have more and more mutations. And so when Delta came out, and then that was, I think we kind of knew Delta was a big game changer around June. And I thought, oh dear, this is not a one and done, you know, get vaccine out there. And it also is a good lesson that unless you're vaccinating the world, so we are, the virus doesn't recognize that we're in Franklin County and that it's not going to go anywhere else. Franklin County is part of the world, you know. So long as there's lots and lots of replication, reproducing of this virus somewhere in the world,
there'll be something coming.
It'll mutate, and you know we didn't know how much the virus, the COVID virus, SARS-CoV-2 could mutate. Delta taught us it could mutate a lot, very significantly. Omicron has retaught us that. So yeah, so this is probably, we don't know. My crystal ball, if that was sitting here, you'd see a bunch of mud like you see on the Chattagee Road in March and April. Okay, so it's not very clear, but it's very muddy. But I think, you know, what these mutations have taught us is that this may not be the last surge. So, but we're, you know,
better prepared.
The day we're sitting here, it is really cold outside.
Yeah.
I still don't have a jacket on, but it was really cold out here. It's really cold. But we know one thing is that summer's coming, spring's coming. Chattagee Road will dry up, and we'll have summer. It'll be better, and winter might come again, right? So it's the same thing with this virus. The surges come in waves. During the peak of a wave, you've got to do everything you can. So, you know, just like on a cold day, you put your turtleneck, sweater, should have had a jacket on, you know, mittens, hat. You have all these layers, right? And the same thing with during a surge of this virus. The big down Parker, the biggest Parker you've got, that's the vaccine.
Yep.
Your vaccine is your thickest layer, your warmest layer to protect you the most. Then you've got masks.
Right.
Do I mask in the summertime? No, I went in and out of Trantons and Hannafords without a mask. Well, actually, mostly masked, but I say probably last June. There was a few weeks where I thought, yeah, I'm vaccinated, we're okay, I don't need a mask. But now I do mask everywhere I go because we're in a surge. I mask indoors. And so masking, and then distancing. So I'm going to get together with friends. We tend to, you know, spread out a bit. And back to the vaccine, I'm not getting together with people, especially inside my home or anything, unless they're vaccinated. Yeah. And then, so masking, vaccine, masking, distancing, ventilation, you know, that's a hard thing to do, but if you could get outside, be outside. I'm getting together with some friends tomorrow.
Yeah, outside.
And we're going to be outside. We're going to be out on the lake. And then the last thing is testing. So over Christmas and New Year's, got together with just a very, very small group, but we took those home tests. I went and got those home tests, and we tested each other, even though we were all vaccinated. So vaccination, masking, distancing, ventilation, and testing.
So Dora, will you come back on the show maybe in a couple months and update us on what's happening?
I'd love
that would
to,
be
sure.
great. All
Absolutely.
right. Thank you. That was great, Dora. Thank you so much for your time. That was
you.
really, really good. Thanks for tuning in. Listen to what Dora said. Get vaccinated. It'll make a huge difference in what's going on out there. We'll see you next time. Thanks for tuning in to Talkin.